Good morning, everyone. My name is William Visser. I'm a current fourth-year urology resident at Virginia Commonwealth University in Richmond, Virginia. I work alongside Drs. Siff, Adam Klausner, and John Speich. The title of the presentation today is Higher Urgency Scores in Individuals with Overactive Bladder Correlate with Sensation Capacity Curve Shapes During Urodynamics. Our research was funded in part by an R01 grant from the NIH, as well as through a scholarship fund for the medical students titled the VCU School of Medicine Summer Research Fellowship Program. Many of our research projects through our department are focused on individuals with overactive bladder. Individuals with overactive bladder typically have to rush to the toilet due to urgency associated with bladder sensation. These individuals also tend to have higher degrees of bother with their urgency and frequency, and eventually leads them to seek treatment from a professional. There is growing interest in the metrics used to characterize bladder sensation during filling. Typical things in the past that physicians may have used would include void diaries, as well as surveys in the office and urodynamics. Recently, a tablet-based sensation meter has been developed, which can do several different things, one of which is to record patient-reported sensation filling events or bladder fullness during filling, as well as helps us in our research to construct these unique sensation capacity curves, which we'll talk about. The objective of our study was to take the sensation capacity curves that we generated and correlate them to previously reported surveys that included severity of urgency, as well as the bother associated with that urgency. What you see here on this slide is the specific tablet-based sensation meter that we developed. On the left is the actual sensation meter that the patient utilizes during the study. At the beginning of the study, the patient should have zero sensation, which would correlate with 0% fullness of the bladder. And at the end of the study, they should be at 100%. For the study design of this project, we initially screened individuals using a survey. That survey was the ICIQ OAB survey. And what was taken from those surveys was specifically from question 5A and 5B, which relate to the urgency and the bother associated with overactive bladder. Question 5A reads, do you have to rush to the toilet to urinate? And the options are never, which correlates to 0, and all the time, which correlates to 4, and there are 3 options in the middle. Scores of greater than or equal to 2 were characterized as patients who had positive overactive bladder and were included in the study. 2 was characterized as having moderate urgency, and 3 and 4 were characterized as having severe urgency. For question 5B, it reads, how much does this bother you? 0 is not at all, and 10 is a great deal. Anything less than 7 was characterized as low or moderate bother, and greater than or equal to 8 was placed in the high bother category. What you see here is the result of the sensation capacity curves for each individual. Green correlates to R-shaped curves, which there were 7 individuals with this. There were 43 individuals with an L-shaped curve, correlating to the purple lines on the graph on the left, and there were 19 individuals with J-shaped curves. The average of those 3 different curve shapes are on the right, and you can see that there are 3 different subtypes within the population that we studied. In order to perform our analysis, we first characterize the patient as having early sensation or late sensation. Early sensation is defined as having greater than 50% sensation at 50% capacity, and having late sensation was defined as having less than 50% sensation at 50% capacity. We used ROC curves and area under the curve analysis to determine the best fit for R-shaped, L-shaped, and J-shaped. Those analyses are seen here on the right. Participant curves after this were then categorically correlated to the ICIQ OAB questionnaire that was previously mentioned. For our first correlation, you can see that the sensation capacity curve was correlated to question 5A. Those individuals with an R and L-shaped curve were compared to those with a J-shaped curve. Individuals with J were significantly more likely to have either a 3 or a 4 response on the question 5A. And using the Fisher's exact test, we show that there's a p-value of 0.0334. An analysis of question 5B was then performed using the sensation capacity curve. Again, here you can see that R and L were grouped together and were correlated against J for individuals answering greater than 7.5 on the bother scale. Those with J were much more likely to be bothered by their urgency symptoms as compared to those with R and L-shaped curves. Again, a Fisher's exact test was performed and the p-value was 0.0103. Finally, individuals with a J-shaped sensation capacity curve were compared to each other, and it was found that having a J-shaped curve was significantly associated with both severe urgency and high bother. So all individuals here with a J-shaped curve were most likely to answer both 3 or 4 on 5A and have greater than 7.5 as their response on 5B, with a p-value of less than 0.05. So what did we find in our study? We found that the study introduced, first off, a novel method to categorize sensation capacity curves using the sensation meter. We also found that the J-shaped curve was defined with a rapid increase in sensation at the end of the filling phase, and J-shaped curves were associated with both severity and bother common with urinary urgency. Additional studies are needed to determine whether the sensation capacity curves can be used to identify relevant OAB sensation subtypes, and if they can be correlated to different surveys, such as the ICIQ OAB, or to voiding diaries or urodynamics. Thanks so much for your time and attention.